So we now move to the last session of this triplet, and it focuses on three really important actors in the pandemic: the patient, the media, and the NHS. And we've got three really great speakers who are stellar colleagues. We've got Fiona Fox, who's the Chief Executive of the Science Media Centre. We have Chris Monk, he runs a technology education business, but also has volunteered as a patient through the Data and Connectivity National Course Study to guide our work. And lastly, we have Mark Toshner, who is a consultant in respiratory medicine at the Royal Papworth Hospital NHS Trust. So again, please keep the questions coming. So what we'll do is we'll invite Fiona, Chris, and then Mark to say a few opening words, and then we'll move into Q&A. So Fiona, a huge welcome and thank you.
Thank you. Thanks for inviting me. I think it says a lot already about the changing role of the media in this pandemic that this session is being held. So I'm really grateful for that. So I want to start with a headline observation and then make two celebratory points, followed by 2 points, which I think these days we call provocations. And I promise I'll keep within my 6 minutes. The headline is that the media coverage of COVID-19 has been largely measured, accurate and responsible. I could not make that claim about the other stories the SMC has worked on, like MMR, GM crops, statins, e-cigarettes, etc. But I am making this claim about COVID, and it's important that we acknowledge and celebrate it, in particular the role of our science and health specialist journalists have played in it. So, cause one to celebrate. One of the catchphrases at the Science Media Centre is the media will do science better when scientists do the media better. When I set up the SMC 20 years ago, the scientists who did media tended to be younger scientists or those with a passion for public engagement. Typically, their media activity was frowned on by their PIs and heads of department, and they never mentioned it when applying for promotion. My vision back then was to change this culture and persuade PIs and heads of departments to see engaging the media as part of what it meant to be a great scientist. That culture change has been happening slowly for years, but it feels like during COVID, we finally got there with bells on. The scientists doing the media have been those leading the research, running the clinical trials, developing the vaccines. At a time when society needed to hear from the best scientists more than ever, they stepped up. You in this audience, you stepped up. Back to my headline point, the media did science better during this pandemic because the best scientists did the media better. And that has been a huge celebration for me. Cause for celebration too. The media and the public know much of what they know about this virus because of data. Data that has been gathered by scientists, then communicated by those scientists to the media, who then report it to the public. These data sets were not just seen by the government or by SAGE, we all saw them. And because of that, we all learned more about science, about the way it works. And we changed our minds when the evidence changed. We've been able to hear about the number of cases in the general population because the media reported ONS and REACT studies. We learned how much immunity we get after infection because the media reported the Siren study. We know about transmission rates in schools because the media reported the COVID-19 schools infection survey. And we know who is most at risk because the media reported open safely. I could go on, and I'm really sorry to those in the audience whose study I haven't just mentioned. The Science Media Centre got to run all of these press briefings, over 200 since the pandemic began, and that has been such a privilege. When our news media is full of numbers, ordinary people are talking about the data, not the dates, and a graph on blood clotting by age group from the Winton Centre for Risk is sellotaped to the door of my local vaccine centre, I know something has changed in our national conversation. That's a cause for celebration. Provocation one. Too often in this crisis, the communication of this wonderful scientific data has been subject to politicisation, with government communications officers and special advisors heavily involved in decisions about how to present the data and fighting for it to be released in ways that best support government messaging. To my knowledge, there has been no overt manipulation of data, but the timing and the manner of communication of science to the public really matters. I would like to see this change, such that the scientists at universities and arm's length agencies who produce the data, albeit on behalf of government, are allowed to communicate it independently from the government comms machine and the dreaded grid. I also believe it's better for government this way, to let the science speak for itself rather than attracting all the accusations of spin that go along with data coming from ministers. I understand that the statutory code of practice that ONS and government must follow is based on a separation of roles between professional communication of statistics and the government communication of policy. I would just love it if somebody listening to this could investigate doing the same for all big national data sets. Maybe a great role for the new Health Security Agency. Final point, provocation 2. I think it's worth us reflecting on what role for scientists in a pandemic where everyone has become an armchair epidemiologist and everyone has an opinion. The government actually does have to take an opinion and make a decision on how to tackle a pandemic, which will necessarily be based on weighing up the science, the economy, public attitudes, and yes, Daily Mail headlines. So my answer to what role for our scientists when everyone has an opinion is to steer clear of voicing your opinions and provide evidence to underpin the opinions of others. We all want evidence-based policy, and I think by gathering great evidence and talking about it in the media, the scientific community has played a huge role in promoting evidence-based opinion. So my plea to you all is be sciencey and let other people voice opinions. Thank you so much for this opportunity.
Thank you, Fiona. That's a great. We'll now invite Chris to give us the perspective of the patient and the public. So over to you, Chris.
Thanks, Andrew, and thanks, Fiona. Yes, hi everyone. My name is Chris Monk. I'm the COO of a data science education company, Decoded. I'm also on the wider advisory group for the for the Data and Connectivity National Core Study. And in my spare time, I've been volunteering throughout the pandemic as frontline ambulance crew. So I have a few perspectives to be coming at this from. However, I don't think I can speak for the whole public. So this is my perspective on COVID science. I'm not a scientist. I haven't been able to do any research. I'm not presenting this as research. I've tried to touch in on research where I can. However, this is very much anecdotal. And I'm sorry, Fiona, I am presenting opinion here whilst also trying to be a bit sciencey as well. I'm going to talk about the COVID science and the public impression of that. That also is necessarily going to focus, as Fiona did slightly, on how that science was communicated, because that's the only way that the public can consume it. And in particular, this pandemic, swine flu 2010, we were all aware of, but this was the first digital pandemic, the first social media pandemic. And that changed how we were both receiving and dealing with information about COVID. We had the early signs of a pandemic coming out of Wuhan back in December, January. I was probably a bit closer. I'm responsible for our APAC business. So I have a team in Hong Kong who were looking a little bit more closely at what was happening in Wuhan than perhaps we were in this country. However, early on in the pandemic, we were looking at those early signs and people were already starting to change their behavior without really knowing what was going on. There wasn't a huge amount of interest in coronavirus coming out of the UK, but yet the early government messages about increasing your hand washing, avoiding crowded areas and avoiding social events were having an impact. Most people were doing something, and over half of people were avoiding crowding areas and avoiding social events as well. I have linked to all these studies at the end. But people were desperate for data, and there was a real dearth of data. This is A.V. Schiffman. He's a 17-year-old from the United States, and he built one of the first global trackers of coronavirus. I think this shows how badly prepared we were for the communication of this kind of data when 17-year-old developers from the US are building the websites that people are relying on in order to get up-to-date stats and figures in the early days of the pandemic back in January 2020. And we all know that a vacuum, everything abhors a vacuum except for conspiracy theories. And so with that lack of early data, early information, early sort of being on the front foot in communication about this pandemic, we saw conspiracy theories filling that vacuum, 5G towers being burnt down. And that was a very human response to people not understanding where this was coming from and how it spread. We also saw in the early days of the pandemic, this is trust in news information. We saw that trust in global health organizations, governments and news organizations, and especially politicians, all dropped dramatically throughout that first period between April and May, which is when we went into first lockdown. The good news for people in this room, though, is that even though trust in scientists, doctors and experts did fall, it fell by considerably less than it fell in all other groups and other news sources. And our government had to respond to that. We had to start receiving that information and that data in a way that we trusted. It was no accident that these scientists started to appear alongside our Prime Minister in these media conferences. This was based on polling and based on the fact that we trusted those scientists more than we did the politicians. In the response, we saw some really good stuff. We saw fantastic work coming out of journalists. This is John Byrne-Murdoch and his now world-famous data visualizations. I've long talked about the power of data visualization in my day job, and this was a really great example of how effective and scientifically rigorous visualizations can be a really powerful tool for communicating complex data to the public. We saw the UK government coronavirus dashboard that was launched in March last year, a clear and accurate way of presenting up to the minute, but not up to the minute, up to the week data to the UK public. And we saw really effective use of well-known faces and well-known brands by people like the World Health Organization. I'm never going to get that song about wash, wash, wash your hands out of my head. But it wasn't perfect throughout. We saw some bad communication. That's not an equation, that's nonsense. Things like the lack of translation of COVID advice into different languages. We knew that BAME people were more at risk early on in the pandemic, and yet the government were very slow to translate their communication out of English to affect those people. And yeah, Barnard Castle happened. And that had a real direct impact in trust in the government and therefore in science about what we were being told to do in order to control the pandemic. And there was some ugly stuff as well. I don't know who came up with the data visualizations, but showing people a largely brown choropleth, we know that choropleths are really bad data visualizations anyway, with spots of green in it, is just really bad design. And it doesn't take long to think about a color palette. And I've done conferences all over the world, and I've never not had a clicker. So I don't really know what that was about, but at least it's given us a meme that we can always reference whenever we do presentations in the future. But the so what, from a public point of view? Well, the good news is, this is a really weird graph, sorry. It's a decrease is a good thing. It's about being skeptical of science. This is from the 3M, the State of Science Global Report, and it shows that trust in science, or lack of skepticism of science, is at its highest level that it has been in the past 3 years. This is a real positive for science. We've seen that in the work that we're doing at HDR UK. The public have wanted to be involved in the work that we're doing on data and connectivity. We've got some really great examples of surprising enthusiasm for patient and public involvement and engagement. Over Christmas, we expected about 100 or so responses to a survey. We got over 800, and over 500 of those were from the public. But as has been alluded to by Jeremy and by Fiona, we can't throw this away. We're now at one of the best places we've ever been with trust in science and trust in the use of data. But we have to be really, really careful that we don't betray that public trust. We keep governance of data, we keep governance of science appropriate, and most importantly, we communicate clearly what and why we're doing what we're doing. Thank you very much. That was a very quick presentation. I look forward to answering questions.
Chris, thank you so much. And we'll rapidly pass the baton on to Mark, who joins us from Papworth. So Mark, thank you.
Thanks very much. So I thought I would start by telling you what it felt like to recruit in the pandemic. But rather than tell you, I thought I'd just show you actually. So this is me back at the end of 2019. I don't know if that's coming up, is it? There we go. So that happy smiling chap didn't know what was coming. The guy on the right is not his older, wiser, sadder brother. That's me 6 months later. And I think this basically tells you all you need to know. This was a very, very stressful time. So was that stress worth it? And the short answer is yes. I've been very lucky to contribute to a number of these world-leading trials, and we won't go into too much detail about them, but they have largely defined the therapeutic and vaccine space for both the country and the world. It wasn't inevitable, and I think it's critical that we acknowledge that. At the start of the pandemic, we had significant anxiety at the proliferation of small and medium-sized trials, and this is work I did in collaboration with the MRC BSU, just basically demonstrating the gap between aspiration and likely delivery. So these two lines of numbers needed to recruit to finish trials and likely recruitment never meet. And in fact, this has panned out. Most trials have not finished and reported, and we relied effectively on recovery to tell us what treatments worked and didn't. It wasn't simple, and I don't think anybody should tell you this in anything other than retrospect. And what do I mean by that? Well, this is a Slack channel, so it's just a communication tool that we set up in February of last year. And at this point, we had just under 90 people from 3 different trusts. This was just the delivery arm of our kind of research effort. These were the people on the ground trying to consent people and trying to take bloods and ferry them about the hospital. There was a whole massive background army, and that army consisted of 2 things. It was a professional army, and we'll come back to that in a second, and a conscript army, or some of them might describe it as a Shanghaied army. At times it felt a bit like we were building the car as we were running it. It was a very challenging thing to do 10 years of research in 1 year. So how were we able to do it? So this is my own personal perspective, and there's been a lot of focus on the wonderful academic leadership that we've had, and I think that's right, but perhaps not so much in some of the less glamorous areas, and so I'm going to highlight some of them today, and in particular I'd like to focus on governance and infrastructure. So you only know that a regulator is doing a great job when nobody is complaining. I think the MHRA and the HRA did an astonishing job. Every single academic I know put an application in, and those applications were being processed within days. And that extends out to the decisions they made in regulatory and licensing of therapies and vaccines. I don't think they put much of a foot wrong. But none of this would be possible, even with that wonderful setup, without the NIHR, and that really was the professional army. In my experience on the ground, everything that was valuable done in the pandemic was done through the engine of the clinical research facilities and the clinical research network. And lastly, I'd just like to highlight that the concept of central coordination is anathema to most academics. We don't like being told what to do, but the urgent health priority system is the reason that we were able to focus all of our resources, or most of our resources, on big and important trials. So things like the clinical therapeutics advisory panel for COVID have been critical in helping us coordinate that response. But that was then, and this is now. So is this just a wartime structure? And I'm going to argue not, and I'm going to use the example of Heal COVID, which I'm the joint chief investigator with my wonderful colleague Charlotte Summers in Cambridge. That's a post-hospital trial, the first post-hospital platform, and it came in response to data that came out of the ONS at the turn of the year that demonstrated that medium-term outcomes are pretty terrible in COVID. So 1 in 10 people is dead within 3 months of discharge, and another 1 in 3 is readmitted. This study was conceptualized and then delivered in a matter of weeks, and is now open across the country in what will be close to 80 centres, and really demonstrates there's an ongoing real appetite for embedding clinical research and clinical practice. We'll be in 100 plus centres by the end of the month. So I think we can do this, that we can tackle complex problems at speed, but it's a choice, and I'm going to reflect that back to the audience. Why limit this to the pandemic? Earlier, Patrick Vallance said that what are the big things, and how do we shape our national clinical research infrastructure to enable to deliver this sort of research in areas outside of wartime, and I think many health inequalities could benefit from this focus and approach.
Mark, thank you. Absolutely terrific. And as a man who went grey in his mid-20s, it's not that bad, I should. So, and we're now going to move into 8 or 9 minutes of Q&A. And can I thank the delegates? We've got some great questions coming in. And what we're going to do is start with trust, because I think that's been a theme through Jeremy, Patrick's, and all your presentations. So maybe ask all the panelists, in demonstrating trustworthiness, are there other strategies for improving public trust in science and health data other than communication? And secondly, do you think that the public trust is already waning? So 2 great questions from the audience. So maybe start off with with Chris, and then Fiona, and then Mark, just to make a few comments on demonstrating trustworthiness. So, Chris.
Yeah, public trust is waning as we move out of the war footing, as Mark talked about, and it's something I talk about in data and connectivity. People will put up with a lot when we're under attack or fighting a virus. As we move back to BAU or LAU, life as usual, trust is becoming a rarer commodity. And we've seen that with the recent furore around the sharing of GP data on a global scale. I'm sure all of us have been in family WhatsApp chats where people are saying, should we be doing this? Should we be opting out? Why is this a good thing? And all of us have had to try and sort of put that public point of view. In terms of other tactics, it's all about communication. It's all about transparency. And it's not just about saying what we're doing. It's about saying why we're doing it and what the benefits of what we're doing are, and doing that in a way that engages people, not in a scientific way. Telling stories, using human stories that people can latch onto to understand that actually having your GP data shared on a national level will allow us to preempt and prevent emergency hospital admissions if done in the right way. They are compelling stories that we can tell. But if we don't do that, if we're just relying on, I hate to say it, but scientists communicating with the public without a translation or without lay people feeding into that in order to unpick what's going on, then we won't win those hearts and minds. So I don't know if there is anything outside of communication except for better, clearer, and layperson-friendly communication that involves stories that attract people.
Okay. So Fiona, any thoughts on this?
Yeah, so I think, I mean, I've obviously made my key thought, which is that I think scientists being sciencey, sticking to the evidence and not handing over their data to government to communicate without acknowledging the risk of that in terms of public trust. So I've made that main point. I think also with this one being open about uncertainty and complexity. I mean, we just didn't know. And one of my frustrations has been hindsightism, where all these commentators came in May, June and July and told the scientific community what they'd got wrong in January and February. There was so much we didn't know. And I think key to public trust was that those scientists were open about what they didn't know, what they couldn't possibly know at that stage, and the complexity that we've just heard about setting up these traps. This is very, very complicated. And I actually think the public showed us in this that they are extremely, they are not to be overestimated. They are extremely sophisticated in their ability to understand lots of different messages, evidence that changes. My other point on this would be resisting being politicized. I say this because there's been a big row recently about whether the origins of the virus came from a lab leak or from natural sources. And what we've seen is scientists not entering that debate because it's become politicized and toxic, and other scientists entering it, but accepting that politicization in a way. And I think we just really need to make, I liked the last phrase about we have a choice. We have a choice in these things, on face masks, on testing, on some of the issues that became really politicized. Again, my answer is be sciencey, but don't either enter or exclude yourself from a debate because it's political. Because if scientists just stick to the science, then they can just better inform those debates and make sure that they are less politicized than they would otherwise be.
Okay, perfect. So, and can we just unpick that a little? So if I was to put being sciencey into a thesaurus, what are the key characteristics of being sciencey?
Talking to the evidence. So that's what my point was, that when everyone's got an opinion, then what is the distinct role of scientists in a country where everyone is talking about one issue, COVID-19, and they've all got opinions and views and different areas of expertise, of course. But what role for scientists in that is to speak to, well, number one, do the evidence. And this event is absolutely glorious to me because virtually everybody involved in these studies are doing the studies. I mean, it's remarkable to me that they also have time to talk to the public, but they do. So doing the studies and then speaking about those studies on the data. So a classic example, I said we've run 200 press briefings. Almost all of them, one or two journalists have chanced their arm and said, thanks for this REACT study. What do you think the government should do tomorrow about opening up? Should we cancel Christmas? Should people be allowed to fly in from India? Now, obviously, there will be some experts who can point to data to answer those questions, but mostly the people in that room at our press conference are talking about a data set and cannot possibly say what they think the government should do unless they've decided to give their opinion. And that's why I'm in favour of leaving opinions at the door sometime and just talk. So it's that when you talk, the distinctive thing that I love, when I came into science 20 years ago, I just thought I am staying here because unlike every other field I'd been in, scientists are saying a thing after having looked at that thing in depth for 20 or 30 years, after conducting experiments, after doing research. They are speaking from evidence and deep expertise. Politicians aren't, obviously, of course they're not. They're moved from one department to another every year or so. And that's fine. They are what they are. But what I don't want to see is those two merging and scientists behaving like politicians. One of the things I hate about conventional media training is when I see media trainers telling scientists how to avoid the question, do things in a soundbite, be clear about your key messages. I don't think we have key messages in science, do we? We have data.
Yeah. Okay. So lovely. And Mark, anything to add?
So the only thing I would say is that I kind of reflect the question back in itself, which is that in fact it's the other way around. I think good communication relies on trust. And one of the things that I've learned over the course of the last year is that different populations trust different people. So it's been a bit of a surprise that anybody's listened to me on social media or on conventional media. My own family don't listen to me most of the time, but I come from an area of trust. I'm both a scientist and a clinician. And so that automatically confers me with some people a degree of authority, and you have to be careful what you do with that authority. But it's not uniform, and in fact, for some people, I'm exactly the wrong person to speak to them, because there is plenty of good reasons for communities to distrust clinicians and scientists, and it's important when we're thinking about how we communicate to have a diversity of voices, of independent voices out there, because it's not always us that people will listen to.
Okay, and we've got time for one last question. So this is an anonymous question, but it's about training, about scientists and NHS staff. So how best should we train scientists to communicate about uncertainty and complexity? Who wants to pick that one up?
So
Fiona,
I can start with it. Oh, I'm sorry. Do you want to go, Fiona?
Mark, why don't you kick off?
Yeah. So I mean, I'm a bit of a convert to this because I'd done literally none of it until last year, and I got a bit of a crash course of it over the course of the year. I think exactly like Fiona said, a formal training is something you have to be a bit careful of, because then we all end up saying the same thing. I think most scientists are pretty comfortable actually with uncertainty. The problem they have is with communication. And so I think it's just about picking people who are natural, who are good communicators, and who are involved in the areas in which they're talking about, and also comfortable to say, I don't know, when you stray outside of the things that you do know about. So I think too much formal training isn't probably a good thing, but I've had none, so maybe I'm biased by my own experience.
Right.
The media trainers are going to absolutely hate me. I hope they don't get to hear about this. But honestly, I just really want to emphasize this has been the worst 2 years of most people's lives, but what a joy and pleasure we have got in my team every day, 2 or 3 times a day, with a panel of 4 scientists. Actually, I might go back and do a survey. How many of you have had media training? I know it can be useful, but I just think they are so good at what they do. And it goes back to this point about science. They know their stuff. And by the way, you've got science and health journalists at these briefings who don't want slick, and they don't want messaging, and they don't want spin. They want to understand the data. And they've been amazing during this pandemic at really struggling to understand the data so they can translate that to the public. But there are so many media stars. I think, I heard the science minister at some stage talking about we need our scientists to be better communicators and come out of their ivory towers. I thought, oh my God, where have you been? You know, they are. I don't think Andrew Marr and Question Time and Any Question, I don't think they will have programs again in the future without having scientists on, because they've had the likes of Jeremy Farrar on, and they've had Anne Johnson on, and they've had these amazing scientists who are fantastic communicators and who distinguish themselves by knowing what they're talking about. So yeah, I think Patrick and everybody has talked about how things have changed. We've speeded up, we've done things, and that wasn't because of systems or training, was it? It was because of people knowing that what you needed to do to make these trials happen. And I think, yeah, I don't think you need to be an expert in communication to talk to the public about your science. You need to be a very good scientist.
Fantastic. I'm afraid we're going to need to wrap it up there, folks. So on behalf of Anne and myself, can I thank Fiona, Chris and Mark. We've had a terrific opening hour. We've set the scene globally, and Jeremy has clearly indicated we're at an inflection point geopolitically, and we need to prepare for future pandemics. Patrick has emphasized the need for robust research infrastructures embedded within policy. Thirdly, we have a global responsibility to do this well. And lastly, if we are to do this well, we need to demonstrate trustworthiness and have better relationships across all the actors required for a pandemic response. And I'll finish by saying we all need to be more sciencey. So that's the phrase for today, Fiona. So can we thank you for that? Can we thank all our participants? We now have a 7-minute break, and you will hear about the National Core Studies. Anne is chairing that session at 10:10. So go and make a cup of tea, and we look forward to seeing you in 7 minutes' time. A huge thank you to everyone.